What is obesity? Obesity is the accumulation of having excess body fat. It is the result of energy input exceeding energy output, which means more calories are being taken in than there are being used up. This causes an energy imbalance. One of the attributing factors is having a BMI greater than 30. Body mass index, or BMI, is a commonly used index to classify obesity in both men and women. To calculate your BMI, you simply calculate your weight over your height squared and multiply that by 703. Some common risk factors associated with obesity are genetic predisposition, a diet of increased calorie intake, sedentary lifestyle, certain medications, and a lack of sleep. There are two different types of adipose tissue distribution in overweight individuals. Visceral is a central fat distribution found in the upper body of men, which portrays an apple shape. Subcutaneous is a peripheral fat distribution found in the lower body of women, which portrays a pear shape.
So short-term food intake regulation involves neural signals from the GI tract, blood levels of nutrients, and the GI tract hormones. For the most part, the short-term signals target the hypothalamic centers via the solitary tract and nucleus in the brainstem. There are many different ways that your digestive tract can tell that you're hungry or full. There is a two-way conversation between the gut and the brain using the vagal nerve fibers. With distension in the GI tract, it activates and sends signals to the vagus nerves that suppress the appetite center in the brain. Now we're going to look at the pathways of short-term food intake. There are two sets of opposing neurons in the arcuate nucleus, which is located in the hypothalamus of the brain. Starting with short-term controls, which are vagal afferents, which are activated by the distension of the GI tract, nutrient signals, which are glucose amino acids and fatty acids, gut hormones, which are insulin and cholecystokinin. Those go to the solitary nucleus in the brainstem. And when those three controls are stimulated, it activates the pro-opimelanocortin / cocaine and amphetamine regulated transcript. That neuron releases an alpha melanocyte stimulating hormone, which activates the ventromedial nucleus neurons. Activating the VMN neurons releases a corticotropin releasing hormone. All of that suppresses hunger. Now we're going to look at the gut and other hormones, ghrelin, glucagon, and epinephrine. When those are stimulated, they activate the neuropeptide Y, a GUDI-related peptide, which releases neuropeptide Y, which activates lateral hypothalamic area. And that neuron releases orexins, causing an individual to feel hungry. So now we're going to look at some of the long-term effects of the food intake regulation. So some of the key components for long-term controls of feeding behavior is the hormone leptin. It is secreted exclusively by adipose cells in response to an increase in body fat mass. Leptin indicates the body's total energy stores in fat tissue. When levels of leptin rise in the blood, it binds to receptors in the arcuate nucleus that specifically suppress the release of neuropeptide Y and stimulate the expression of the cocaine and amphetamine regulated transcript. Neuropeptide Y is the most potent appetite stimulant known.
In a normal cell membrane, adipose tissue releases adiponectin, which is a protein hormone, which stimulates insulin sensitivity. When there is an increased level of glucose in the blood, adiponectin signals for the release of insulin from the pancreas. Insulin then binds onto the receptors and onto the cell membrane, and this action triggers for the GLUT4 transporter to use exocytosis to migrate onto the cell membrane. This then allows glucose to enter the cell for ATP. Now, in an abnormal cell membrane, there is an overstimulation of the pancreas, which releases even more insulin. The insulin then binds onto the receptors, activating the GLUT4 transporter to use exocytosis to allow an increased amount of glucose to enter the cell membrane. In obese humans, they have a low level of adiponectin, which decreases insulin sensitivity. This means that there are high levels of glucose in the blood, and when that happens, the blood stores it as excess fat, and this results in gaining weight.
Some of the signs and symptoms of obesity include excess weight gain, fatigue, shortness of breath, and increased appetite. We're just going to review some of the key concepts, so we'll start with homeostasis. Normal homeostasis is energy input equal to energy output. However, in obese individuals, there is an energy imbalance, creating energy input being greater than energy output. For proteins, leptin is a protein hormone that provides signals to the brain to inhibit neuropeptide Y, which is the most potent appetite stimulant. But for a reason unknown, in obese individuals, there is a resistance to leptin's actions. Cell membranes Due to the increase of food intake and increase in adipose tissue, there is an increase in leptin secretion, therefore increasing the stimulation of fat storage.
In summary, obesity is the accumulation of having excess body fat. Two risk factors associated with obesity are genetic predisposition and increased calorie intake. Excess weight gain is a common symptom that's related to obesity in humans. When they have a low level of adiponectin, this then decreases the insulin sensitivity. This means that there are high levels of glucose in the blood, and when that happens, the body stores this as excess fat, and this results in gaining weight.